Okay, ladies, welcome again to the second part of exploring perimenopause and menopause. Today we're going to focus on treatment with hormone replacement therapy, herb and botanical, and also continue with the lifestyle. Okay. So again, my name is Lisani Estopinian. I'm a medical doctor specialized in internal medicine and also getting my certification in functional medicine. Okay, so let's just begin into the hormonal and non-hormonal therapies. And I want to explain a little bit about all these kind of like bad cloud that we have behind hormone replacement therapy and where all these kind of myths come from. So in order for do that, we have to come to go all the way back to the beginning. So in 1942, it's when the first hormone replacement therapy was approved by the FDA. And the name of this medication was Premarin. Premarin is estrogen medication that is an artificial type of, or synthetic type of estrogen. And at the time, this was revolutionary. I mean, Pfizer is the company that actually released the Premarin for the first time. They make millions of dollars at the time. And every doctor was actually prescribing it and promoting the use of these hormones. And basically, I mean, every woman at the moment started actually using it. So what happened was that they realized that taking only estrogen then increased the risk of having uterine cancer. So then scientists actually did more research and they found out that when you combine or you add progesterone in conjunction with the estrogen, then it gives that adverse contrast effect of estrogen inside the uterus lining. So then it decreases the risk of having uterine cancer. So this is how the drug Prempro came in place, which is a combination of estrogen and progesterone. And this was only indicated in women who were still having a uterus. Those who had a hysterectomy, meaning a surgical removal of the uterus, then they did not need to have the progesterone in combination. So the largest scientific research that has been done or conducted on women's in menopause was called the Women's Health Initiative. And this is a federal finance study that was studied in the late 1990s, and it ended early in 2002. In these studies participated around 160,000 women post-menopause that they were enrolled, and they were divided on 3 groups. Basically, one group received estrogen, and those are the ones who did not have a uterus. The ones that had a uterus have combination of estrogen and progesterone, and then they were compared with women who were taking placebo or were not taking any hormone replacement therapy. And then the study came to be terminated 3 years early of what it was planned, because they came with a statement saying that hormone replacement therapy was too dangerous, and this is because of the increased risk of heart disease, stroke, blood clots, and breast cancer. However, it's not as simple as it sounds, because we have to look actually at the study a little bit closer just to see what were the downfall and how the study was conducted in order to come to those results. So like I explained before, one group has estrogen and progesterone therapy, which is the first trial of the group, and those are women who were having the uterus, and those women received Prempro, which was a combination of synthetic estrogen plus progestin, which is also a synthetic form of progesterone. The second group received only estrogen alone because they didn't have a uterus, and they received Premarin alone, which is the estrogen only. Okay, so the study or the results show at the time that the first group, who was taking the combination of both hormones, actually came back showing that they had an increased risk of a stroke, blood clots, and breast cancer. However, the second group also had an increased risk of a stroke and blood clots, but they had a 22% reduction in breast cancer. So how does that come to this? Well, we have again to look at how the study was conducted. So the wrong drugs tested on the wrong population. So first of all, the type of hormones that they used in the study was actually synthetic estrogen and progesterone. They actually used a drug that is basically the estrogen is coming from the urine of pregnant horses. And the urine actually has at least 10 different types of estrogens, which doesn't necessarily correlate with, our chemical composition. And then the progesterone was also medroxyprogesterone, which is also a synthetic type of progesterone or progestin, which is used pretty much on birth control pills as well. And we're thinking that that could have made a huge difference because, again, these chemicals are not exactly similar to our natural estrogen and progesterone. The other thing that was important is that these hormones were given by oral route. And there is a difference when we receive oral estrogens versus we use transdermal route, meaning through the skin, which it could be coming on the form of a cream, a gel, a patch, or a spray. When we're using oral estrogen, basically it gets absorbed in the gastrointestinal tract, and then it has to go into the liver where it goes to the first bypass metabolism. And that changed the chemical structure of the hormone, increasing actually the risk of producing blood clots and also increase the risk of hypertension in women who take oral estrogen. The transdermal route doesn't do that. It goes strictly in the skin, and then it goes and do in the tissues what it's supposed to do, so that the risk of having these potential complications is lower on the transdermal or skin formulations. The other thing that it was important is that the women in the study were actually postmenopausal, meaning were women who were already on the late 50s, 60s, and even 70s. So you also have to kind of think this, that, well, these women probably already were having a higher risk anyway, so they start developing these chronic conditions, including heart disease and including also, again, a risk of strokes. So it was necessarily the hormones, or it was that they already went in an age where they were actually already starting to develop these conditions. So additional studies were done after that, but back on the days, unfortunately, these statements actually show that patients having a high risk of breast cancer and strokes and heart disease. So this kind of leads to everybody to be afraid of actually start using these hormones. Luckily, the study was revised, and then they find out about all these downfalls that were how the study was conducted. And then additional research has been done since then. And actually, in 2022, the North American Menopause Society published an update position statement about the risk versus the benefits of hormone replacement therapy. And these revisions has been endorsed by another 20 international organizations that has been also supporting the use of hormone replacement therapy on women who are in menopause and they have symptoms. So is hormone replacement therapy really causing breast cancer? And the answer to that is that actually no, the risk is very low and actually is very rare and has been proven in other studies that has been done after that. The executive director of the North American Menopause Society actually make a statement saying that most healthy women under the age of 60 or within 10 years after having their last period can actually take hormone replacement therapy without fears. Hormone replacement therapy can be helpful to reduce the risk of hip fracture, heart disease, colorectal cancer, diabetes on the long term. Also, the guideline says that estrogen plus progesterone therapy does not significantly increase the risk of breast cancer on the short term, meaning less than 5 years, but it is associated with a very relatively and a small increased risk over long term, meaning more than 5 years. The risk is higher when using oral conjugated between estrogen which is again synthetic estrogen combined with medroxyprogesterone acetate. The newer formulations, which are called bioidenticals, estrogens and progesterone, seems to be actually less risky and more effective compared with the old drugs from back of the days. Estrogen-only therapy does not increase the risk of breast cancer for cancer-free women without uterus when taken up to 10 years. And I want to clarify here. So if you're going to use hormone replacement therapy and you already have a hysterectomy, meaning you don't have a uterus, basically you can only do replacement with estrogen alone. However, there is no contraindication that if you have symptoms that are not well controlled necessarily only with estrogen, you can still add progesterone. There is no contraindication for that. However, what is malpractice is that if you do have a uterus and you're going to go into hormone replacement therapy, you should not receive estrogen alone. You should be combining with progesterone. Okay. The other thing that has been on the guidelines now is that vaginal and topical estrogen has not been linked with an increased risk of breast cancer on the short and also on the long term. And this is the vaginal estradiols, like the creams, the rings, the suppositories that are used vaginally, or including the tablets that are inserted vaginally. And this is typically to help women who does have vaginal dryness, discomfort with intercourse, that they benefit to use this kind of therapy. Only if it's contraindicated, hormone replacement therapy is recommended for women who go through menopause early, either if it's spontaneously or surgically. So it is recommended that after you do have a oophorectomy, which is when they remove your ovaries, both of them, women should start early hormone replacement therapy at least until average age of menopause, which is around 51 to 53 years old. Okay. Contraindications versus proven indications. So hormone replacement therapy should be avoided if you are pregnant, if you do have unexplained or abnormal vaginal bleeding and they don't know what is the cause, that needs to be investigated first. If you do have active liver disease, for example, cirrhosis of the liver, or if you do have some sort of liver disease, if you do have uncontrolled hypertension, you want to make sure that you get that under control first. And if you do know or you are suspected to have some sort of hormone-sensitive cancer, such as breast cancer, it is also important that you hold on any therapy. If you are currently on the treatment of breast cancer, you should also avoid it. And if you either have recently or you're actively getting treatment for a recent arterial blood clot, which is a blood clot within the arteries, or you had a blood clot within the veins, which is called a DVT or a pulmonary embolism, or if you have a previous or current coronary heart disease or coronary artery disease, a stroke, or a heart attack, also you should hold on initiating any therapy. The FDA has approved hormone replacement therapy for women who actively have vasomotor symptoms, which include hot flashes, night sweats. It also indicated for prevention of osteoporosis and genitourinary symptoms, especially on the estradiol vaginal forms. They are very, very beneficial. However, there are no FDA approved that are possible benefits from taking hormone replacement therapy. For example, to help with the sleep, to help with depressive symptoms that are not related to previous history of major depression disorder, but it's just linked to perimenopause or menopause, and also to help with the brain fog and forgetfulness. Okay, before I explain about testosterone, I'm just gonna briefly mention a few things. If you do have a family member, let's say my mom, grandma, or my maternal auntie who had breast cancer, that is not a contraindication to use hormone replacement therapy. Only if it's a personal history or you're actively have a breast cancer, then it is only contraindicated. And actually, the American Society of Menopause make a statement that women who had a history of breast cancer, potentially there could be an exception if they do have severe symptoms of menopause that despite of non-hormonal treatment has not been controlled, then this could be discussed between the patient's doctor or gynecology and the oncology to make a decision if the women could go or not go into hormone replacement therapy, kind of like overwhelming the risk versus the benefits. If you also carry a genetic predisposition, I don't know if you ever heard of the BRCA genetic test, where you have the BRCA1 and BRCA2, which carry increased risk of breast cancer and ovarian cancer. It doesn't necessarily mean that if you do have the genetic predisposition, you cannot use hormone replacement therapy. Obviously, genetic counseling is important. And actually, on those women who decide to go ahead and prophylactically, meaning as a prevention, go ahead and go under a bilateral mastectomy, bilateral or a complete hysterectomy, removing ovaries, removing fallopian tubes, uterus, and both breasts, in order to protect themselves from developing cancer, like this famous actress Angelina Jolie, she did several years ago. Women actually could benefit of using hormone replacement therapy, because basically when you remove both of your ovaries, you go into early surgical menopause, and then again, this is when the hormone replacement therapy becomes beneficial. Okay, so going into testosterone therapy, unfortunately, there is no FDA approved hormones that has been approved for women's. Versus there are bioidentical FDA hormones approved, estrogen specifically in the form of both orals and also transdermal. I do prefer to use the transdermal if it's possible, and the reason is because of what I explained, that bypassing that first metabolism in the liver, and also there is bioidentical FDA approved progesterone, which is called progesterone micronized, and again, they're safe. They have been studied. The FDA and the companies has made sure that these chemicals are pure and safe, and they are regulated in terms of doses. Versus the bioidentical hormones that are made as a compound in pharmacies, they do not have these regulations, or they have not these standards of safety in terms of the chemical composition, which is the only thing why you have to be careful when you go and use these compounds in pharmacies, because again, they have not been really tested or regulated. Actually, on some women who use pellets, again, the same thing. These medications are not regulated, and it actually has been cases where women who has been using pellets that has testosterone, for example, they have been checking the levels, and the levels has come back 10 times higher of what is actually the normal range of testosterone for a woman. So it is important that these pellets are managed by a doctor or a practitioner who know what they're doing, and they actually monitor the levels in blood to make sure that, again, you are not having elevated amounts of therapy with this type of again replacement. So on the testosterone, the guideline says that you can use testosterone therapy in addition to hormone replacement therapy. It is considered to take it if you are already post-menopause and you are actually taking estrogen therapy with or without progesterone, and you still have persistent decrease in sex drive, but no other causes that it could be leading to that. Remember that yesterday I explained a little bit about the cortisol still, chronic stress, how that can affect. So, if there are other things or other illness in place that could be contributing to the decrease in libido, severe depression, for example, again, you should be treating those conditions first. But if it's related just to hormonal, then you can add testosterone. If you have reduced sex drive, depression, and fatigue after surgically induced menopause, meaning that you go to bilateral oophorectomy, removal of both ovaries, and estrogen therapy hasn't helped to relieve the symptoms, you can also add testosterone in the therapy. There is no reason why younger women who are perimenopause, like me, 43, will not benefit from using testosterone therapy as well. There is no contraindication or anything that says that you could not use it or benefit from it. Okay, now let's go and talk about the non-hormonal therapies. And here I'm going to talk about antidepressant medications. In this case, the SSRIs, which is the serotonin reuptake inhibitors, receptor inhibitors. The one that is approved by the FDA is called paroxetine. Paroxetine is non-hormonal. Again, it's an antidepressant medication, but in the dose of 7.5 milligrams, it has been approved for the treatment of moderate to severe hot flashes and night sweats. It's not going to help with the vaginal dryness. It's not going to help with the decrease in libido. But if you only have vasomotor symptoms and maybe a little bit of mood, this medication is actually can help you without necessarily using hormonal therapy. In 2003, the FDA approved a new medication that is called fezolinetant, which is the brand name Biosa. It's 45 milligrams once a day. It is also non-hormonal. The way that it works is that it goes and mimics the receptors, the NK3 receptors that we do have in the brain, where we have and control the temperature. So this medication acts in those receptors, and it helps with the same thing, moderate to severe symptoms of hot flashes and night sweats. It's actually very effective. I have been using both of these medications in a lot of my patients, and it has been beneficial. Not on everybody, but it does. Another potential medications that can be used include gabapentin, pregabalin, clonidine. They do tend to have more side effects, including dizziness, lightheadedness. Now gabapentin study may first became a controlled substance, so it needs to be very closely regulated. Same as pregabalin is also a controlled substance. Clonidine also tends to have several side effects because it can decrease your blood pressure, but I have using it in a few patients, and it has helped them too. And then for genital bladder or genital urinary symptoms, for example, leakage, incontinence, urinary symptoms like urgency, that they do not improve with the vaginal estradiol, then they can benefit of using medications like oxybutynin, which I don't like too much because it can lead to dementia and cognitive problems, so I don't use it. But I use Gentesa and I use Marbetric. And I think they're wonderful drugs. They work very good, and they have actually helped a lot of my patients. Minimal side effects. Marbetric, we just have to watch your blood pressure. Okay, just a little bit thought here that it is important. I mentioned this yesterday about the microbiome that live inside us. There are trillions of bacteria that live in our skin, mucosa, vaginal mucosa, and in the gastrointestinal tract. And we are obsessed about killing bacteria. And we forget that we have bad guys, but we also have good guys. We cannot go and kill all the time. The good bacteria actually help us to produce serotonin. And serotonin is the hormone that makes us happy. And also help us to produce GABA, which is a gamma aminobutyric acid, which is a hormone that helps us to keep calm and relaxed. So they control also our immune system. 70% of your immune system is in your microbiome, in your gut. So it helps us also to regulate blood sugar and help with our metabolism. So without delay, let's start talking about botanicals. And we're going to start with the black cohosh. So it helps in hot flashes. The efficacy proof or a specific proof of efficacy, scientifically speaking, is actually medium or moderate. And the dose is 40 milligrams a day. And due to the lack of long-term safety, it is recommended to do not take for longer than 6 months continuously. Precaution is that it can cause some headaches. In rare cases, it has been reported some liver problems. Ginseng and maca roots. So this helps with mood and libido. The efficacy, again, it's medium, moderate, and the dose is 400 milligrams daily. And also it's recommended not to take for continuously more than 6 months because, again, of the lack of long-term studies that has been done. Typically, it's well tolerated, but it can cause some insomnia, menstrual problems, breast pain, increase on the heart, blood pressure, headaches, and digestive issues. Specifically, the ginseng can interfere or interact with some blood thinners. So it is important that if you're taking any of these medications like warfarin, heparin, or aspirin, please talk to your doctor before starting any of these medications if you're taking them, okay? Phytoestrogens. So soy isoflavones are called genistein, dasein, and S-quol. It's helpful for hot flashes, and studies have shown that it is moderate efficacy. The dose of recommendation is between 40 to 80 milligrams a day, and also it's recommended not to take it for longer than 6 months. Typically, it's well tolerated. Patients can experience some gastrointestinal issues. Basically, again, it's pretty safe. There is not real evidence that taking or consuming soy foods increase risk cancer. And however, the societies has not recommended use of the soy isoflavone supplements on long term because of the fear of overconsumption. Additional botanicals include red clover isoflavones, which is helpful for night sweats. The efficacy is also medium on the scientific research, and the recommendation is 80 milligrams a day. This has been used in clinical trials for as long as 3 years without having any apparent issues or potential harm. And the safety of red clover for patients who have breast cancer or endometrial cancer has not been established, but also has not been come back saying that you cannot use it. St. John's wort is helpful with anxiety, mood, and depressive symptoms during perimenopause. The efficacy of this actually in the studies has been high, and the recommendation is to take around 900 milligrams a day for up to 12 weeks continuously. You can rest and then try it again later, depending on your symptoms. It can interact with several medications, so you should be talking to your doctor before you start them. These medications include, if you're taking blood thinners, digoxin, which is a medication that people take for atrial fibrillation or atrial flutter, which is an arrhythmia of the heart. If you're taking any anticonvulsants like seizure medications, antidepressive drugs, if you're taking cyclosporine or HIV medications, methadone, or contraceptive medications, or some anti-cancer drugs, you should talk to your doctor about it because, again, there could be some potential interaction. And there is a very safe website where physicians can go and make sure that we check interactions between botanicals and prescribed medications. Valerian roots, it helps and supports sleep. The efficacy of this is medium, and the recommendation is to start with 400 milligrams 1 hour before bedtime. It also comes in tinctures of drops so that you can use between 2 to 5 droppers before bedtime. It's well tolerated, but it can cause in some people some headaches, dizziness, and upset stomach and fatigue the next day. I actually use myself valerian, but on the topical, and I put it to my kids every day. So the botanicals that has been shown low scientific proof or efficacy, however, in some people might be beneficial, include chastity tree berry, donquay, evening primrose, cava, rhodiola, tribulus, and flaxseed. So it doesn't mean that you cannot use them, and there might be some ladies here that maybe has been using them and it has been work for them. It's just that in terms of scientific proof, it has been low on clinical studies. Now let's talk a little bit about supplements, which are important during menopause too. So let's start with the vitamin Bs, and it has been shown that it helps with the stress and cognitive support. This is actually in clinical research has been shown to be moderate to high evidence, and the recommendation is for vitamin B12 to use 500 micrograms, for folic acid or vitamin B9, 600 to 800 micrograms a day, and vitamin B6 between 10 to 50 milligrams a day. Actually, you can just buy a big complex and just take that. And if you really want to support stress, you should add vitamin B5, which again, it comes in the big complex. It's typically well tolerated, and there has not been really any scientific evidence that it could cause any issues or interactions with other medications. Calcium and vitamin D. So it helps with bone health and support. The efficacy scientifically for this is actually high. And the dose recommended for calcium, especially like 65 and older, is around 1,000 to 1,200 milligrams of calcium a day from all sources, including food and supplementation, okay? Vitamin D, the guideline says that you should take around 800 to 1,000 international units of vitamin D. I have to say, people who live in the mountains, here where I live in Utah, we need way more than that. I actually, during the entire winter, I get very little exposed to sun, even when I eat foods rich in vitamin D. And I was taking 5,000 international units of vitamin D every single day with vitamin K2, which you guys should too. And my levels came back at 39, which is relatively low normal. The normal vitamin D levels is between 30 to 100. So 39 is, okay, optimal, no. So I actually am taking currently 10,000 international units of vitamin D. For some people might be, wow, that's a lot. If you live in Florida, maybe, but here in the mountains, no. So generally, vitamin D is well tolerated, minimal side effects. Calcium can decrease efficacy on aspirin and levothyroxine, which is a thyroid medication, and some antibiotics. So it is recommended that you do not take your calcium at the same time that you're taking your thyroid medication or your aspirin. Like take them at least 4 hours apart between one and the other. Also important to know that calcium should not be taken alone. Calcium requires other friends in actually to go to the bones and do what it's supposed to do. So they actually sell several formulations out there that are called like bone support, bone health, or bone cofactors that includes calcium, vitamin D3, vitamin K2, boron, magnesium, manganese, zinc, copper, selenium, phosphorus, vitamin C, and all these should be taken in conjunction in order to support that calcium do what it's supposed to do and doesn't get floating around and then go and deposit as plaque within your blood vessels, and then you get a heart attack or a stroke. Okay, magnesium. Magnesium also helps to support sleep, and the efficacy of these has been low on scientific evidence. I personally love magnesium to take at night. And you can take between 400 milligrams up to 3 grams of magnesium 1 hour before bedtime. There is also creams of magnesium that you can apply topically. I love the one from Minerals. See, what is the brand? I have it here in my room, and I use it on my kids. And generally, it's well tolerated, but in some cases, if you take too much magnesium, it can give diarrhea. Also can decrease the efficacy of aspirin and levothyroxine. Typically, you take magnesium at night. So levothyroxine, you have to take an empty stomach in the morning. But if you take your aspirin, you maybe don't want to mix them either. Melatonin is to support sleep. It has a high scientific evidence. And typically, recommendation is between 1 to 3 milligrams at bedtime, no more than 2 weeks continuously. And the maximum dose around 6 milligrams is usually very safety. Sometimes it can interact with some sedative. Omega-3s. Yesterday, I talked about foods rich in omega-3. This is about supplementation. So it has been used for menopause, for night sweats, and cognitive support. The proof regarding if it helps with night sweats has been low, scientifically speaking. Medium to high, good support in terms of mood and cognition, mental, okay? The recommendation is high purity omega-3s, fish oil or algae oil containing between 500 to 1,000 milligrams of DHA, combined with 300 to 500 milligrams of EPA per day. And they typically come combined. The ratio typically between DHA to EPA is about 2 to 1, or 2 to 1.5. It can interact with some blood thinners, and if you take too much, there has been some evidence that it can cause some bruising or bleeding. Vitamin E is a great antioxidant. It helps with hot flashes, and the scientific has been there for medium to high. So yes, use your vitamin E. The recommendation for somebody who does not have heart disease or diabetes is 800 international units, and you have to take a vitamin E that contains a mix of tocopherols complex, meaning that you want to have, because there are actually 5 different types of, actually 8 of vitamin E, but you want to have the alphas, the betas, the gammas, and the deltas. You don't want to have only one kind. So if you do have diabetes or heart disease, take only 400 international units a day. Okay, we have finished with hormone replacement therapy and botanicals. So let's relax for a second. And now let's just focus on stress reduction and sleep. Now, remember that it's important. I talked to these about this yesterday. Like, self-care is not mean selfish. You matter too, and nobody can pour from an empty cup. So we need to work on ourselves, like I talked yesterday, self-love, and then we can help others. Don't feel bad from taking time for yourself. Now, things that we can do to help to reduce stress in our life. And this has been scientific evidence research that this kind of activities actually helps to improve menopause symptoms. So mind and body interventions include yoga. In several studies and clinical trials, regular practice of yoga for at least 12 weeks positive effect in psychological symptoms of menopause, especially fatigue. And women who practice yoga also tend to have decreased symptoms of stress, insomnia. They can improve their quality of life. They have less hot flashes and less vaginal symptoms and less urinary issues as well. I actually start doing yoga at least once a week. I'm trying to increase to twice a week. Meditation and mindfulness based stress reduction. It is a type of meditation that has the power to protect us from stress overload by modulating the activity of the brain regions in change of worrying, thinking, and feeling. You can look into MBSR and investigate a little bit more about how to practice this type of meditation. Kirtan Kriya is a type of meditation as well that has been also shown that in women with menopause, it can actually help to reduce inflammation while improving memory, sleep, mental clarity, as little as 8 weeks of practicing this. It actually takes about 10 to 12 minutes. When I was actually putting the presentation, it actually showed you, if you search Kirtan Kriya, it actually tells you the steps of how you can do this meditation at home. You don't need really to have an instructor. I mean, you can just do it on your own. And there are actually these apps that are available inside Timer or Headspace or Calm that actually have included this type of meditation that you can practice before you go to bed, for example. Hypnosis also has been referred as planting positive seeds to ease, challenge, or discomfort. Hypnosis has been recommended for treating menopause symptoms for several professional societies, including North American Menopause Society, and it can reduce hot flashes, and it doesn't have very much risk. There's the link of the American Society of Clinical Hypnosis, where you can actually go online if you're interested in research and look for a provider that specialize on hypnosis and to help with menopause. Cognitive behavioral therapy, specifically, this is a type of therapy that is action-oriented psychological intervention that helps people to develop practical ways of managing problems and provides new coping skills and useful strategies. And again, this is the website for the American Board of Cognitive and Behavioral Psychology if you're interested in searching for a provider or a therapy who specializes on this in your area. Other practices that has been also helps to help with symptoms of menopause include paced breathing and relaxation training. I have actually several patients that I have provided information about mindful breathings, and they have been starting to do it like about 30 minutes before they go to bedtime, and they have telling me that it has really helped them to sleep better and relax and decrease the amount of anxiety before they go to sleep. Acupuncture, if you're able to find a good acupuncture specialist, and then aromatherapy and essential oil therapy. that I love, actually. I'm sitting right here using my a aromatherapy while I'm giving you this lecture. Okay, other things that can reduce the stress. Get your team. Get a team that it can help you during this transition. If you're feeling depressed or anxious, again, talk to your family. Let them know how you're feeling. Talk to your doctor or your psychiatry or mental health professional. You can also, during menopause, get a menopause coach or a counselor who can guide you through all this complex process. You can have psychotherapy to help you to cope also with a lot of these symptoms. That is actually for women who has a genital urinary symptoms. You know, they can do pelvic floor muscle therapy and like a physical trainer to help to do exercise in a safety way so that you don't damage or injure yourself. A nutritionist or a dietitian that they can help you to figure it out this plant, greener Mediterranean diet thing, and you can eat yummy and healthy at the same time. And now just sticking to the sleep, right? When we start menopause, our sleep go to the toilet. I wake up every day, even on Saturdays and Sunday, like automatically 6 in the morning, I'm awake. I don't even need my phone or my alarm to wake up because my sleep has been reduced. So sleep tips that we can do at home to help. So exposure to light decrease melatonin levels. So giving the body mixed signals. So if light E cannot be avoided, please then put an eye mask and cover your eyes at nighttime so that you can sleep with complete darkness. Your room should be very, very dark. Dimming the lights 1 hour or so before bedtime, it helps keep your room cool and comfortable. The sweet spot is about 6 to 7 degrees Fahrenheit or 20 degrees Celsius. Use light pajamas, cotton pajamas if it's possible. Use soft lighting, comfy pillows, warm blankets, suiting colors in your room, and clutter-free space that can transform your bedroom in a sleep sanctuary. Make sure that your room is quiet as possible. And don't be this person. That's my husband every night, looking at the phone, and I keep telling you not to. The blue light from phones, tablets, computers, and TV actually keep you awake. The blue lights actually reduce or decrease the melatonin. And melatonin, imagine that is your body lullaby hormone. So you want to keep that very, very high. So while increasing the production of cortisol and adrenaline, which actually make you more anxious. So please turn off your phones, your tablets and computer at least a couple of hours or at least an hour before you go to bed. If you cannot, at least wear those glasses that protect you from the blue light. I think that would make a difference. Say good night to your devices at least 1 hour before you go to bed if it's possible, and try to go to bed and wake up always at the same time because we are animals of habits. You know, you cannot pretend that one day you're going to go to 8, the other day you're going to go at 1 in the morning, and then 10 in the morning. Try to make yourself on habits, okay? And do a brain dump, meaning write down what is in your mind before you go into bed. That can help you relax. Sometimes we go to sleep and then we're thinking of what we're going to do tomorrow. I have to call this person. I have to do this. I have to do that. And that creates anxiety. And anxiety increases cortisol and adrenaline. So we don't want to do that when we're going to go to bed. So is that what's going on? And you're just turning in the bed? Get up. Go and make yourself a tea without caffeine if you want to. Put a little of relaxation music, do some mindful breathing, do a meditation. But also, if you're having all this in your mind, grab a book, make a to-do list for the next day. And also you can keep like a grateful journal where you actually write about what you're grateful for today. You know, be thankful for all the good things that you have in your life or the good things that happen to you today. And then close that and then go to sleep. Because ladies, you're not going to open the grocery store at 1 in the morning. You have to wait for the next day. So go and sleep and relax. Again, do meditation before you go into bed. And if meditation is not your thing, then maybe just put some quiet, relaxed music. Maybe the wave sounds, the river, the water, something that relaxes you, it will be beneficial, but not the TV. Use the bed only for sleep and for sex, nothing else. Do not watch TV or use any devices like laptops while you are in the bed because it brings mixed signal. And then endocrine disruptor chemicals. Well, these are chemicals contaminated that mimic your natural hormones. And they're doing so, they sneak and scramble the messages to one to another. So these disruptors are known as xenoestrogens or foreign estrogens. Think of them like your estrogen evil twin. They're bad for you. So they send mixed messages to estrogen receptors and they trigger hormonal imbalance throughout the reproductive system. And they're on everything. So ways that you can reduce environmental pollutants in your life. So if you quit smoking. Smoking decreases your estrogen levels and brings menopause sooner than what you want. Women who smoke at least 100 cigarettes in their entire life, the studies have shown that they have 26% greater risk of going through early menopause in their 40s compared with women who does not smoke. So you can also use indoor air purifiers to keep your air clean, eco-friendly holds products to wash and to clean the house. Use plants inside the house. Things that you could do also is clean foods and water. Check the ingredients on the labels and try to avoid things like high fructose corn syrup, hydrogenated and partially hydrogenated fats, monosodium glutamate, artificial food coloring, sodium nitrate, gums, and sodium benzoate. And when you can, try to shop local, and if it's in your budget, try to buy organic. Why? Because it's not the same from, that tomato who came all the way from Guatemala, and it took so many days to actually get into your grocery store than, from the farmer that is just a few miles away from you. Glass is the new plastic. Yes, so we should try to switch all the plastic bottles for glass if it's possible, or stainless steel. Swap your bottles of water. I have a beautiful crystal bottle that I have in my office that it has crystals underneath and is made with glass. I love it. Try to ditch or get rid of the non-stick pots and pans and use instead cast iron, stainless steel, and tempered glass if it's possible, and try to avoid to warm your food in plastic containers. I actually have for my office, I have a glass container with a plastic cap. I take the plastic cap, put it in the microwave to warm up my food for a minute, and then I'm not eating any plastic. Love it. Amazon. Okay, never heat the food in the plastic container, please. Please don't do that when you warm it up in the microwave. Avoid also to take out foods in plastic container if this is possible, and also be mindful about your personal care products. Believe it or not, we even have endocrine disruptors and hormonal disruptors in everything. I mean, our makeup, our deodorants, even our tampons, pads, shampoos, I mean, everything you name it. They do have toxins, unfortunately. It took me almost a year to swap everything to things that are free of chemicals or hormonal disruptors. I look at ingredients and containers and everything now when I buy things. It's more expensive, but on the long term, it's not going to affect my health. These are just a few websites and apps that you can use. EWG or the campaign Safe Cosmetic that you can use and download so that you can look at safe, free of toxin products. Rethink menopause and have the power of a positive mindset. So mind over menopause. You are what you think. If you think that you are defeated and you think that this is gonna, destroy you, it will. Don't worry about fixing yourself because you are not broken. You're just going through this transition. it should pass. And again, it depends on the strategies that you use to help yourself. Laugh it out. About a month ago, somebody asked me, when was the last time that you laughed to the point that you feel that you almost were going to pee in your pants? And I couldn't remember at the time. I was so upset about the fact that I haven't really laughed in such a long time. And recently, during Memorial Weekend, we went camping and I have a blast. I laughed to my knees during the entire time with my kids, my friends, and I love it. It actually increased my oxytocin, which is a hormone that makes you happy, relax you, decrease your cortisol, and help to support your sex hormones. So yeah, laugh it out, enjoy your family, hug your kids, hug your husband, pet your pets, and again, enjoy life. Keep a journal for your experience if you want to. Use your emotions as tool. Try to flip things around. And again, gratitude is not a platitude. So you also have to be thankful that people who support you and help you. Please also give a little bit of break to our spouses that sometimes when we're moody, we just answer to them with a very bad attitude and they don't even know what they did. And the new menopause is that so many women see menopause as an ending, but I have discovered that this is your moment to reinvent yourself after years of focusing on the needs of everybody else. This is your opportunity to get clear about what matters to you. Pursue that with all your energy, time, and talent. This is Oprah Winfrey. And second, okay, there you go. All right, and that's it. Just questions. And thank you so much, everybody, for joining today and listen. And then we are going to try to unmute everybody. So if you guys have any questions, I don't see any questions on the chat. And if you guys missed the class from yesterday, it's going to be